Thank you all the team behind organizing this important one-day symposium. And thank you, Professor Vani Chichi and others on the panel. So my role is to respond to the presentation, and probably I'll take few more minutes to discuss the other side of the public health, that is the private part of nurses, which situations are all the more difficult and very precarious working conditions. So from the presentation of Jayakrishnan sir, it's very clear that multiple roles being juggled by the public health nurses, and they have to do all the care activities in a comprehensive sense, preventive, promotive and curatorial roles as nurses. Along with, they are supposed to take care of all the social determinants of health aspect as well. So it's not mere absence of disease. For the complete well-being of the society, the responsibility comes to the public health nurses. So they should be the act as managers. They should be the lawyers arguing for the rights of the people, and coordinators, leaders, and even researchers. And these multiple roles being assigned to the public health nurse. So my question is it only the responsibility of public health nurses, or can we redefine these roles a bit? Definitely, that comprehensiveness should be there, and involvement in that comprehensive manner is necessary. At the same time, is it humanly possible to have all these roles together? And what kind of a remuneration are they getting for that? So I think we need to revisit the roles. Definitely, we have to have a comprehensive performance. At the same time, limiting the roles like any other. You can attribute the same roles to a teacher, same roles to students, everyone. So we take as social beings, as political beings, as concerned citizens, we have a lot of other responsibilities. But we redefine our work role in a manner that it has to be doable. Say, for example, being a leader in the society, that role, and if something happens, a dowry death happens in the locality, can we blame the public health nurse over there? Because it's her responsibility to prevent. So I think we need to have a revisit and redefine the roles of public health nurses, definitely agreeing with the comprehensive aspect of it. And thank you, Professor Renu Susan, for her presentation, which clearly discussed about the health situation, public health situation in India, and how the kind of allocation, doctor-patient ratio, doctor-nurses ratio, where we are. And then we need to discuss a little bit more about the political commitment of the state to invest more on public health. So we have a very shameful amount of GDP we are spending on public health. How much are we spending? What is the proportion of GDP we are spending on public health? Any idea?
Less than 2.
Yeah, it's just reaching 1, not less than 2. We're just reaching 1. And how much are we spending on defense? So you just need to look into that. So I'm telling that in the presentation of Dr. Vani Kesari, she was discussing about the public health, in the introductory remarks, she was discussing about the public health structure which Kerala has developed, and how the preparedness of it with all its limitations. I'm not talking about it, this is the model with all its limitations. We know that during the pandemic time, we had a model here where across the globe, it admired it as a model of public health, because if you remember the past 3 decades or past 4 decades of neoliberal political economy, the withdrawal of the state from the social services, probably we are one of the exceptional states which fought back those neoliberal economic policies and stood for social welfare measures and investing in public health. So that investment in public health as a political decision of the state of Kerala, which has actually reflected in the in dealing with the pandemic and the strength of the public health structure in India, in Kerala. So vis-a-vis India, we see that we have, even if whether we are going there or not, but those who are in need of that system is available. I'm not saying that this in the complete sense is the perfect. Without all imperfections, it's available, and now it's improving a lot. Go to the public health centers or CHCs, you see the difference. And again, a medicalized society like Kerala, we have tempted to approach the tertiary care system or the private system. That we look into ourselves. It's not the problem with the system. System is there. And I would like to add on one aspect here, coming to the conclusory suggestions by Professor Renu. It's about why are we having a system where we are not bothering about nurses. She was talking about the education system. She was talking about the labor department and the kind of respect. Why nurses are not getting the ample respect which they are supposed to get? What is the reason? Why is it so? It's because we know that major portion of nursing sector is recruited by females. This is a gendered labor. Gender plays a crucial role here. This is, when we are talking about care work, we know that it's sexualized care work. Who takes care of elderly in the popular domain or in the stereotypical understanding of gender roles? So that gender roles get extended to the service sector as well. And when women become the major portion of the sector, that sector is not getting the proper respect and proper admiration. So we see that the patriarchal notion of the society, notion of women, their gender roles, and this sexualized care work, it has a connection. So when we talk about policies, when we talk about law, we need to see that linkage, the patriarchy and the work role of women. So I'm coming to that by explaining one of the small study we conducted in School of Indian Legal Thought, myself and my colleague Robin T. John. It was during the pandemic time. We were all kind of frustrated being inside home, and we were worried about the world where we are moving, and we are worried about the burden of nurses, especially our study was focused on the private sector nurses. That doesn't mean that government sector and public sector everything was good. It wasn't. It might have its own limitations and problems, but the kind of problems faced by the private sector nurses were no patch with the government situation. So we have interviewed, it was during the second half of 2021, a study we conducted between July to November. And we have interviewed 785 respondents. I thought just to present briefly what we have done, because being the students of law, how are you going to connect this matter with our own academical interventions? So I think it's very important to see that connection between what we are discussing in a seminar and how are we going to do it in the everyday level of our academic interventions. So we have done interview of 785 nurses in Kerala, Malayalis I would say, and in which 51 were outside India and 95 of them were outside Kerala. And we have 182 respondents from Ernakulam district itself. So more than 90% of the nurses we have interviewed, they are female nurses. And 60% of them, they have done this 4-year bachelor's degree. And interestingly, a significant number of them had taken educational loans to study this course. And I think that indicates the employability of this course. So and that reflected in the interviews as well. Soon after the course, most of them, they've got enrolled in jobs. That is, employability is there, but whether with a decent and dignified remuneration, no. It's mostly without salary, and some of them is negligent amount of salaries. And it's very, very pathetic. I can't even reveal. And when it comes to the nurse-patient ratio, in private sector it's dangerously high. And usually it's 1:4. For every 4 patient, there has to be 1 nurse. But the study clearly shows that it goes like 20-30, 1:20-30, or at some hospitals it goes even further. And then come to the question of salary. We talk about minimum wages in Kerala, but when it comes to the private sector nurses and private sector other healthcare workers, it's very hard to see achieving that labor rights. So many of them, they don't have the minimum wage prescribed by the government of Kerala. And many of the, I would say more than 80% of them, they don't have any pension or any provident fund or other health insurance schemes. So you see, whatever we talk about in terms of labor rights, absolutely violated in the private sector. And then let's discuss about the duty hours, working hours. That's also part of labor rights. So we talk about 8 hours, but most of the nurses, they have 12 hours duty. And when it comes to night duty, it's mostly 12 hours. And in the interview, we could see little about 20% of the nurses, they're forced to work more than 16 hours. So you have to consider the kind of job nurses are doing and how much attention is needed. And then you think about this long span of working hours. So you see the issue there. Since we have conducted this study during the COVID period, we were looking into the burden of extra COVID duty. So it's very, very difficult kind of a situation they all went through. This continuous duty, like there are nurses whom we interviewed, they actually did 48 hours duty and all, because they couldn't get out of the hospital. And some of them worked almost more than a month without a single leave. And in the initial stages and at the middle of it also, without proper protection. PPE kits are not, many of the hospitals it wasn't available for the nurses. So those who are higher in the grade, probably they might get, but the junior nurses and all, they actually contacted even the COVID positive patients without PPE kit. And they didn't even have food, water, or even a toilet break. So they worked in that level. And out of 785, almost 600 nurses were they're working in Kerala. So at the end of the study, we had contacted them to get to know the information whether they have infected COVID. And 77% of them infected COVID, and they got the infection from their workplace. So this clearly shows the kind of safety parameters, or how their protection is the consideration of our society. So I'm just flagging in the picture from the private so that you get a comprehensive understanding of what is the scenario in public and how worse it is in the private domain. So we are yet to come up with the report of this study. So I would like to conclude by saying that definitely the roles which we are talking about, the comprehensiveness of it is important to ensure the public health of the society and our journey towards health for all. But at the same time, we have to have humanitarian, human right, labor right consideration of workers, those who are standing for this cause. And we need to see the question of gender here. That's very crucial, because many of the negligences and many of lack of consideration which is coming from our patriarchal understanding of the world. Thank you.